I'm Amy Pesic with Digital Health Strategies. Welcome. We know that for a patient, the journey usually starts with finding the right doctor. So getting these profiles right is everything. Welcome to Provider Profiles Access and Conversion. We have a great lineup today. Susie Gurmer from Tufts Medicine, Kyle Kilpatrick from Yext, and Marshall Schoenthal from Phase 2. Please take a second to silence your phones, and we'll have a refreshment break after this, a coffee break. And please also take time to fill out the survey in the app. We'd greatly appreciate that. And from here, I'll let Susie take over. Thanks so much.
It's actually Kyle.
Yeah.
It's okay.
It'll be me.
Yeah.
All right. Nice to see everybody, and I imagine everybody is either hungover or ready to leave. So thank you for coming to the Wednesday morning session. As it was introduced, I lead the healthcare sales team at Yext. I have two wonderful partners next to me. Been at Yext about a year and been in the space, close to 10 years previous at another company called Reputation.com as well. And I'd love to pass it to Susie to introduce herself as well.
Hi, everybody. Susie Gurmer. Gurmer-Gilkey now. I got married, so hence the two G names. My role at Tufts Medicine is I'm the Senior Director of Marketing and Digital Strategy. I've been there going on 7 years. I've been in healthcare for about 20 years. Have really kind of built our MarTech stack from the ground up, so really proud of that, and have some great learnings that I can share with you guys, and you can pick my brain and I can tell you all the things not to do. So hopefully this will be a good presentation. Marshall?
Thanks, Susie. Marshall Schoenthal with Phase 2 Technologies. Phase 2, for those that don't know it, it's a digital agency. We work with large health systems across the country on digital patient experience, digital apps, digital health care. I've been working with Susie now for probably 3 years. 3 years. And have been with Phase 2 for about 8 years. So I'm our industry principal for healthcare. So I work with all of our healthcare clients, really making sure that we're the things that we're learning, we're able to apply that kind of across our client base. So really excited to be here with Susie and Kyle.
Okay. All right, it works. Okay. The story is always time that marketing is being asked to do more with less at this point, and this session is obviously going to cover that standpoint. And Susie actually has real-world examples of just how she went about that, and Marshall will obviously share more as well. And Marshall will kick it off with you. As marketing is asking me to do more with less, and as we go into this new landscape, what are you seeing from your side in Phase 2?
Yeah, so I think we've all sat through a lot of different sessions, and there's a lot of common themes. And the thing that I'm seeing and talking to our clients about and our research teams when they're talking to patients, it's really a change in the overall story. If we go back 3 or 4 years, and someone was diagnosed with chronic kidney disease, right? They're meeting with their physician, they're understanding the disease, they're getting referrals. It's a lengthy process. They're doing their research. They're talking to friends, and that entire story is now changing. And I think what we're seeing now is, and I think I heard it in other sessions and have experienced this. You're getting your test results in. You're seeing your blood, your blood work there. You're seeing you're in the abnormal range. You're immediately on ChatGPT or one of the other LLMs. Understanding what this really means, and you're starting to look for a nephrologist. And so, thinking about this in the context of Boston, you're immediately going in there, talking about what your results are. What kind of doctor do I need? What are the best places to go? I'm finding that doctor online. And so all the research that was taking place on Tufts Medicine is happening in the LLMs, and so when they're getting to Tufts Medicine, they're so far down the funnel that really we're into this conversion game, and so making sure we have the data to support the LLMs as they're feeding that up, and that once they get there. We're able to convert them fairly quickly, and so it's really it's an entirely new game. I think, from where we were 2 or 3 years ago. And there's other things out there. I think we're all kind of combating misinformation that's out there on social media platforms and TikTok. But really, it's this LLM world I say that's changing the customer experience. Is that in line with what you all are seeing?
Yeah, agreed.
Okay. I think we're going to move to the Tufts medicine story.
Yeah, so it was interesting when we started 3 years ago. I'm not from Boston. I always tell my clients you know your market better than I do, but Boston is unique. I live in Milwaukee. My wife works at Freighter. It's the only game in town, right? There are other systems, but Freighter is the monolithic, large academic medical center. But in Boston, no. You've got Mass General, you've got Beth Israel, right? And so you're competing against two other big, established, respected health systems. But then you're also dealing with all the other retail competitors, CVS and Walgreens and urgent care clinics, and you're also now competing against AI, right? That is it's a medical professional that or not professional, but it's a medical resource that lots of people are looking at. So I think, what you're seeing then is that patients are coming in much more informed, sometimes misinformed, depending on what they're looking at. And as I said, they're kind of getting to Tufts medicine at this point, and it's no longer I'm going to read a bunch, I'm going to spend hours on the site. You got 20 seconds, and you've got to get them converted. So I think that's when we look at Boston, you can't think about it as the same as Milwaukee or even Chicago or New York, which have similar problems. It is a unique market. So Susie, you know it better than me. Tell us about.
Anybody here from the Boston market, actually? Friends? Hi, friends. Okay. So you'll appreciate this. So Tufts Medicine, a little bit about my system. We have only been a system for about 3 years, so we're a baby system. And we're much smaller in size when it comes to our competitors like the MGBs and the BI Leahys of the world, who were at the conference. So I was hoping that they were going to come and say hi. But so we have about a little over 3,000 physicians. Our crown jewel is Tufts Medical Center, which is our academic medical center. It's been around for 230 years. So we're celebrating this year in a big way. But they're our big academic medical center. Then we have, a behavioral health hospital. We have community hospitals. We have about 500 ancillary locations around, the Boston area down to Cape Cod. So, we kind of span the gamut, again, between academic and community. And so, but we're small in comparison to our competitors. So when we decided to take on this project of coming together as a health system, we needed to rebrand all at the same time, and then also build a website that kind of presented us in a system, right? Or as a system, I should say. So we had to bring together about 10 disparate websites. So you can imagine all the work that went into the vendors, the agencies, all the content. That's a massive project. Has anybody gone through one of those projects before? Yes. Okay, so you feel my pain. Okay. So in doing that, we had all of this disparate data, right? So we didn't know who the source of truth were for locations or for Find a Doc. We didn't know who had what, where, and how. And so we had to kind of figure all of that stuff out as we were building, this one system-wide website. And of course, our goal ultimately was to be consumer friendly and show that we were one system and had great access, right? Which operationally, coming together as a system, we weren't there yet. So still a work in progress, but so that being said, that's a different slide than I thought it was going to be, but that's okay.
There we go.
So as I was talking about the data validation, we didn't understand where all the data lived. So first and foremost, we had to kind of do a discovery of where all of the Find a Doc data was, where all the location data was. We brought all of that together So we pulled that from 5 different data sources, and we worked with IT to pull that into a data warehouse. Then we cleaned and validated that data within our own teams, and then we took that data back out to all of the departments and stakeholders across the system, and then asked them, is this data right? Does this look accurate to you? And then we tested it, and we tested it and tested it and tested it before we went live. And so we kind of validated that the data at the point of go live was about 94% accuracy. But that took a lot of manual work. That was me looking at spreadsheets until 2 o'clock in the morning. That was my team, double checking our spreadsheets like 2 and 3 times. Now we're kind of more automated, but at the beginning we had to kind of figure all of that stuff out. And that data validation has really kind of been the foundation that has helped us kind of take these next steps. So.
Well, I told you I was going to throw some curveballs in here. One of the things that I thought about when we first met with Tufts Medicine, I remember your CEO saying, we wanted to show up differently, right? We didn't want to just be, another health system website, and if you squint, no offense to people in here, they all kind of look the same. We've got Find a Doctor and locations and services. Right. And as I think about how the world's evolved, we still show up differently, but it's not from a visual standpoint as much as the data that you're pushing out there. And I did a little Claude search this morning. I was thinking about Tufts Medicine, and it talked about scrappy and personable, right?
Yes.
As describing you, and when you think about Tufts versus MGH and Beth Israel, scrappy and more personal is something that that aligns with kind of with Tufts, and innovative was another thing. So it is interesting how even showing up differently visually has now translated into from showing up differently with your data out there to the public.
Yeah, I mean we're kind of known as being small and nimble. We also punch way above our weight because we're smaller. We try to treat each patient not as a number, but as a patient. Our doctors try to go by their first name. We try to have a different type of culture at Tufts, and not just be, a sterile academic, system. So we try to be a little innovative, a little nimble, and a little scrappy. So I think that's a good brand position for us. Absolutely. Yeah. So this is our current homepage of our website. This is not what we went live with. This is talking about a little bit of brand positioning. Excuse me. We have repositioned our brand recently, and so this is like the display of that. But this is our current homepage, and then on the next slide we have an example of what our mobile version of our Find a Doc looks like, and we're really set on trying to get all of our physicians on online and open scheduling, which if anybody's going through that process and working with your MyChart teams and working with your operators and stuff, sometimes that can be a hurdle in and of itself. So we work really, really closely with the MyChart team. I'm best friends with all the IT guys. Like we geek out on some of this kind of stuff, and they're great to work with, but sometimes it can be hard operationally to get everybody on the same page. But it is our goal to make sure that getting to an appointment is as easy as possible. That's it. So whatever we need to do to get there, we're going to try and get there.
Can you talk a little bit about how you got IT on your side? Because that may not be the easiest thing to do.
Yeah. So I'm good at kind of translating IT speak into marketing speak. So I'm kind of the in-between between the IT guys and then the rest of really like my team, and kind of almost like, again, translating some of that technical knowledge. But it really started at every level. So I worked with our CIO all the way down. And I work with the guys who pull the data. I know who's pulling my data. I know how they're pulling it. I know what the issues that they run into when they pull data. I talk to them on a regular basis. Before go live, I was on meetings with our IT team for hours on like a Friday afternoon. We would be, because they're all over the country, sometimes all over the world. So we would sit on a Friday afternoon and we would just go through scenarios and we would build data and we would talk through like what the issues were and how they needed to do it. So I understand I think at almost every level what their pain points are, and then they understand then what my pain points are and what I need. And so I can come to them really at any point and say, hey, this connection is broken or something's not working or I'm not getting this financial data. Can you help me? And because we have that relationship, they're willing to like jump in and help me at any point. But it takes trust and it takes time, and they know I'm not going to do anything weird with the data and I'm not going to abuse the data. And I'm doing it for all the right reasons. And so we have that kind of camaraderie.
Yeah.
Yeah.
Seems like Claude called Tufts scrappy, but you're pretty scrappy too. Right?
She is.
I've taken on the personality.
Yeah, okay. We'll go on to the next one.
Yeah, so real quick, these numbers are ridiculous, right? So like after launch, like we had insane numbers. We increased our Find a Doc visits like 183%. Our, booked appointments went through the roof. Again, you have to think about it, like we brought all these entity websites together onto one platform and then unified everything. So everything's now flowing through that process. And of course, my mind goes to how am I tracking all of this? How am I making sure I'm getting all the ROI on this? How am I making sure that everything's kind of set up so that I can show these numbers? The other thing that's crazy about this 88,000 number is that's like 2 people. So I have one person who is dedicated to Yext and making sure that our Find a Doc and location database is the best that it possibly can be. But she's a one-woman show and she doesn't have a data background. She's learned this in the last like 3 years, right? Because also, just to throw this out there too, as we came together as a system, we also came together as a marketing team. We were all individual marketing departments. And so we all had to come together as one. And I kind of became the de facto digital leader. And so I had members of my team that they were just front-end web producers, or they were content writers. They weren't data people, they weren't Yext experts, they weren't developers. So we kind of had to pull that whole team together. And so that number is her work, which is really cool when you think about it, because talk about like doing less with more, right? Or more with less. Opposite, doing more with less. She's able to do that type of work in a very automated fashion. And we have such a good relationship with the Yext team that they help us do a lot of that work. And so we can make updates like constantly to Find a Doc. So it's never sitting there stale or stagnant.
Yeah.
The other thing, you mentioned your team coming together. Everybody needs to recognize, Tufts Medicine was coming together. So you had a brand new leadership team at the executive level. You were bringing together service lines for the first time. So, at large academic medical center, talking to, community, hospitals in Lowell, and trying to understand how are we going to work together as a system? How are we going to, get the most out of our, the resources that we have and focus on kind of resource optimization. Which surgeries do we want to be doing at Lowell versus what do we want to be doing at Tufts Medical Center? And I think that there's a lot of moving parts to that. So it's not just, all right, let's put a digital front face on something that is established. Let's put a digital face on something that is evolving, as we're moving forward. So
and it continues to be like we're only a 3-year-old system. Before that, we were a holding company, so we really didn't have the systemness, if you will, of a well-established system. But we also didn't have the bureaucracy either, right? So we were able to do things and move things, and I'm able to talk to the chief operating officer, and I'm able to talk to the chief information officer, and I don't have to go through like 10 layers of approvals, to get stuff done. That's changing as we become a system, right? To be expected, but we were kind of all growing up together, and we continue to grow together. So it's a unique experience, but yeah.
Yeah, I think that's an important point too, because as most systems are probably going, right, they're not maybe as free and willing as your team was in the beginning when you started doing this stuff. And if you do have an opportunity to recognize maybe that the system right now to really innovate, and you have some good leaders that'll lean in, maybe that the Tufts team did early on, like take advantage of that, because it seems like it got you guys pretty far.
Yeah, I mean, it was really like everybody had to pick up like jobs that weren't theirs. Everybody had to jump in and work on, and this is also like kind of tail end of like COVID too. So there's all that madness still going on, which everybody here can relate to. And there was no, this is my job description. As I was saying before, like Kelly, who works on Yext, she has no background in that. She just kind of came in, jumped in, liked it, enjoyed the work. She's good at it. And so we're going to keep her in that spot. But yeah, it just was, it was very, scrappy and innovative and maybe not typical, but fun. So
it was also
it was really interesting. Yeah.
It was our first Yext implementation as well. So it was, we found a good partner and someone that we could, evolve with, but it wasn't like Yext had done thousands of Find a Doctors at this point. So it was, we were all working together to
right.
how can we turn this partnership into real outcomes for the patients you serve?
Yeah. Yeah, and again, as the entities were separate, we had to bring all of the vendors together, reestablish what we wanted to do as a MarTech stack, renegotiate all the contracts, figure out which vendors we wanted to keep, which we wanted to let go of, and kind of build everything from scratch. And then we had to find vendors that were willing to work together. Like this, these guys don't talk to these guys. This doesn't integrate with this. Not happening. Not on my watch. So everybody had to play ball, and everybody had to play ball together, and these guys talk to each other more than they talk to me, which is good because they talk outside of me now and try to solve for problems together and then come to me with the solution, which is amazing. So, and I have other vendors that do kind of similar things too, but to be in our MarTech stack, you have to be willing to work and integrate and automate with the vendors that we already have in place. And if they're not willing to do that, then sorry kids, I can't do it. I don't have the time or the people.
I think I can talk to most people at Yext over Slack because we're tied up there as well. So it's not let's schedule our quarterly meeting with the vendor and talk
right.
then. It's daily conversations, which I think was critical to us. And we'll get to this later, but us solving problems post-launch, right? Because everything wasn't perfect.
Right, right.
To use the word a third time, it's a scrappiness amongst the teams too, doing this. So
scrappy is going to be the new tagline.
I know.
Yeah, we'll see,
We're just a scrappy academic medical.
We'll see how many more times we can do it. All right.
Okay. Yeah. So I think Susie, some of these numbers I find pretty interesting. So when I look at branded keywords up 15%, doesn't really seem like a lot until you start thinking about this was a new system. Right?
Yeah.
So Tufts Medicine, was something new. One Tufts Medicine, new concepts, and so you really started to see kind of that brand recognition starting to take hold in the community. And then the 112 increase in search engine impressions. That doesn't happen by accident, right? That was a lot of data, being curated. This is your late nights of working through the spreadsheets. And then when I look at 47% positive brand sentiment and 50% neutral, right? Just we can all do the math, right? And so again, that's not just luck where people are all of a sudden like, oh, we've landed on the Tufts page and I have a positive impression. It's we have curated the data, we have pushed the data out there, we've ensured that we are putting our message in front of patients so that they are able to build that positive perception of a brand new entity and something that they didn't really. They knew Tufts Medical Center.
Right.
They knew Lowell as a hospital, but they didn't know what this new thing was and how it would change. And especially with the individuals out in kind of the more suburban parts of the Boston market, am I losing this kind of nice community hospital? Is it being swallowed up? Is it going to become an academic medical center? And that's not what they wanted. They wanted the resources of the academic medical center. But the local feel of that community hospital, and I think we were able to, through curating that data that Susie's team did, to get to that point. So if we keep moving on, so we had this great kind of brand visibility, I think, but then, if you go through each of these things, what we saw was really an increase across the board. So I'm looking through some of these, clicks to appointment up, requests an appointment up 33%, phone calls up 45%, but the 125, clicks to register, and for events, and you think we would focus just on, clicks for appointment, but registering for events to me seems like a really big one because, this is not something I have to have. I'm registering for something, that Tufts is offering, which is increasing that kind of loyalty to the system, the engagement with the system. And so I think, across all of these things, you just see that the hard work that went into ensuring that the website was easy to navigate was important, but that we had all the right data out there to then draw everybody into the website to then convert quickly on everything, as I said, from booking an appointment to registering events to to donating.
And these are kind of vanity metrics, right? Like these are like your soft engagement metrics, and they're directional, right? They're telling us that things are working and people are finding what they want to find and they're engaging with the site. And so this is like a good first step. But as I was talking about before, these aren't like the metrics that, when it comes to the business, are what's going to like drive the appointment request and then that downstream revenue. So, but these were good to see that we were getting that engagement and that people were finding what they wanted to find on the site. And then as we get more and more sophisticated, we get more and more down the funnel of then showing ROI metrics, and then what do these types of metrics then evolve into, and how do they actually impact the business? So like that's like the next phase as we're going through our data journey. But yeah.
Okay. All right, then we go over to the Find a Doc experience as Susie and Marshall have talked about the build and to get up to this point and what that actually looks like in practice, right? And we've looked at appointment metrics and as she said, some of the vanity metrics, but when you think about the search term data that you can see up there, right, those are intent signals, right? And this is a byproduct of some of the hard work that got done, and as you can see there, those aren't just top of funnel metrics. Some of those are specialty service lines. Some of those are primary care. But what it really shows is that Tufts is really positioned right now to be ready for the patient at the right time, and even in this involving search, right? So what they're doing now, with patient searching on the different language models and different avenues that they're looking for now, they're finding Tufts for what they need. And as we go into the next one too, right, to even put this into perspective, because I think most people have their numbers from quarter-over-quarter increase or year-over-year increase, but what they don't have is a benchmark against what the industry is doing, because you don't necessarily know if you're doing well, if you're not doing well, and what that looks like, right? So relevant doctor search, you can see Tufts is at 92.5% versus 85% of the industry benchmark. I don't need to tell you that that's impressive, because it clearly is. And then I think the other aspect of this that stands out, right, is a click-through rate of 53% versus 25%. That's not an incremental improvement, right? That's a vastly different search experience for that patient. And what Susie and the team have done, just continuous with the work and building up to this point, they really are living to the term of meeting that patient where they're at and finding the access and really increasing that. And to really kind of nail this at the end too, I know it's slightly lower, but the 65% increase in the year-over-year search, and this is 2024 to 2025, generally what that shows is that consumers have had a good experience on the search on Tufts, and they find what they need and they go there. And it's going to continue to make them want to go back and go to that search, because if they have a bad experience, they're going to find a different avenue to go search for care, even if they have to go to Tufts. What this is showing, and it'll be fascinating to see next year, where that performance is, because clearly patients are enjoying the experience that they're having when they look on that search. Okay, so Marshall, now that we've launched this behemoth product, we've talked about establishing the data, now you move on the task of optimizing this, because this is not a marketing side project. This is an iterative process that you got to keep tinkering away. I think we met yesterday to figure out how we're going to keep tinkering, not
Right.
for this talk, but
Right.
it was that. So can you tell us about that and how that looks of optimizing and kind of carrying this forward?
Yeah, I mean, internally at phase 2, when we do a launch, there's always an email that goes out and everybody's excited. And I like to say, I bit of a weather forecaster. I always see kind of dark clouds that are out there. And that's when I start getting nervous, right? Because, all right, it's the end of the beginning. And so now we're into the stage of, okay, we've got this new site. Yep, it's on brand. All the links work. Everything's working. It looks great, but we have to continue to drive that, up and to the right. And that's a series of, it's not all right, we've just got a backlog. There are those things that we know we've deferred and we need to get them done, but we now have a baseline, or we're establishing that baseline, and we have to keep moving it up. We want more appointments booked. We want less people, leaving the site. We want more donations, more events, and so we're kind of constantly looking at, how do we drive all those numbers up, and how can we continue to tune it? And again, that's a partnership. And I think when you all are out there looking for people who can you bring on board that's going to have that critical eye and says, yeah, we're up 20% on this. Can we get 25? Right? Can we keep that? Can we keep moving it forward? Because your competitors are. And not, again, it's not just Mass Gen and Beth Israel. It's the CVSs and the Walgreens of the world that are making it easier to get the flu, flu vaccines and anything else, and telehealth taking away. So, we were continually pushing that from day one to ensure that we were moving forward. And so, it's not always big things. Again, I think people get caught up in what's the new big feature. We want to add a chatbot. We want a symptom checker or one of those things. It's the real meat of it is, let's look at this, let's look at this page. It seems that, pages that have these types of photos on it are converting better, or if we actually move the call to action up or change the color of it, it moves up. Can we talk about clinical trials more, right? Getting some sentiment from the clinical teams of, hey, we are scrappy, but we're also, an academic medical center that's doing real research and real clinical trials. We need you to elevate that. And so we started pushing that up more, and saw the results of that at Tufts Medical Center. Trying to see all the other things, integrating with Orchid ID, again, another tool that I'm not sure if everyone else here is using Orchid ID, but making it easier to know we've got the right academic content that's out there for them. What were some of the other things that we started tweaking?
Well, yeah, pretty much all of it. I mean, to be honest with you, there wasn't, so Tufts Medical Center, before we integrated, had a process for physicians to update their profiles. But when we came together as a system, everybody was kind of doing it a little bit differently, and the expectations of the physicians were very, very different, right? So we had, again, come together and build a process, and then also build data points that everybody had on their profile and that everything was consistent. The Orchid ID thing is interesting. Is anybody else, who else is using that on their profiles? If you have clinical trials, I would highly recommend it. Our physicians obviously are very familiar with it, but they didn't know that they could use it in this instance. They are always like, can you just link out to my PubMed? And so when you do that, sometimes there's some inconsistencies with the data that pulls back, and then they get very annoyed when the clinical trial that gets pulled into their profile is really not them, because there's 200 John Smiths in the world, So that kind of data integrity and process building is something that the team looks at on a regular basis, and then we're constantly tweaking this. So to Marshall's point, we're looking at what's converting, what's working. We're adding things to make the user experience better. People from Boston will appreciate this. We're adding MBTA directions, so that's that's the train, so the T. So it's subway instructions and bus instructions onto the directions and things like that to kind of it's not rocket science, but it makes things easier for the user, and then also gives the physician the confidence in their profile, because they use these to go out and ask for, research funding. They use these for their own conferences. So this is kind of their online CV, and so it's very important to them that it tells their story. And we're doing some cool things that I think we're going to talk about in a little bit too, to make that process even more automated and even better for the physicians.
Yeah. Where were you getting most of the feedback from on the profiles? Like, was it just from physicians, or were you getting it from kind of all across the organization?
Just the physicians. They know what they want, and rightfully so. So and again, like each entity had their own way of doing things. So pulling that together and saying, okay, this is how we're going to do it, kind of moving forward, has been an iterative process in educating, various groups of physicians. But we're getting there, and when the profile is filled out well, it converts very well. And when the physician is engaged and wants to update their profile and is invested, it converts. And we've seen that again with those vanity metrics we showed before. So
Yeah.
So it is interesting. I mean, as you're doing all this, it's not just, all right, I can go off and do whatever I want. There are additional hurdles that that we had to go through, and so budget constraints. When we launched the site, they doubled your budget. Yeah. So
no, they cut my budget.
So like the work gets harder. We've got more. We got higher expectations, and we've got the same or less of a budget, and so we're having to do more with less. Scheduling complexity. I'm sure most health systems in here, everyone's saying we want online scheduling. It sounds super simple. I can book everything online. But not once you get past, it's difficult with primary care. Once you get into the specialties, it gets even more complex. But then when you're bringing together specialties across multiple organizations that had different ways of working, it's not just the technical challenge is not that difficult. It's the change management of it, to get them aligned, to make sure that they want to work together in a certain way. And not that was all of marketing's job, but to make sure that we knew how to optimize.
I do get pulled into it.
Yeah.
And I'm happy to, right? Because again, how many of you have open and online scheduling? Yeah. Are you guys involved in that process, or do they just tell you what you're putting up on the website? Yeah. So they originally came to us and said, this is just what you're putting up on the website. And I was like, what is this? Because if you go through the journey as a patient, you're like, I can't navigate this. Like, I don't know what the heck I'm supposed to be doing here. And it's very confusing. And again, you add the complexity of multiple locations. Some locations are on open scheduling, some are not. So our primary care, so we had primary care online scheduling, half of them weren't on there. So how are those people supposed to navigate through the system and still get an appointment at a location that is not on online scheduling, but they're doing it online? So how does that whole patient journey work, right? It's a nightmare. So again, I work really closely now. I just inserted myself into that process. And I was like, when you have a kickoff meeting, include me. I'm gonna be there. I'm gonna listen to all the technical stuff. I'm gonna go through the whole process with you guys. And then I'm gonna write out the patient journey for you, including the copy that goes in my chart. That's how granular we get, because that's how I feel like we partner, and how we get. It's not the technical piece of it that's the hard part. It's getting the patient journey and putting yourself in the shoes of the patient and making sure that you can navigate that process. And then if you can't, you got to be like, time out. We have to change this because this isn't going to work. And we're actually going back on a couple of our service lines and redoing their online scheduling journey, because it's just so clunky. But I would just try to insert yourself as much as possible in that process, and again, be a partner. You're not trying to take over anything. You're just trying to make the access that much better.
Yeah.
So.
No, all great points. I think the other, we've already talked about kind of the evolving brand, which was another hurdle to get over. And vendor selection, I'm going to pat myself and Yext on the back. I think we did a good job of building a team.
Yes.
Of people that will work together, and it's not I'm sure there are days our tech folks and the X folks are like, we're trying to figure out a problem, and it's not no, it's the X fault or it's phase two's fault. It's, hey, we've got this thing that needs to be fixed, right? And how do we get there? And that, and that's done through communication. Again, our dev teams are on Slack all day long, saying, hey, we've got this problem, how do we fix it? Can you all change something on your side or their side? Or is it just, or is it a data problem? And we've had data problems.
Yep.
Data is going to continue to deteriorate, and we got to continue to keep it clean. So it's, again, it's vendor selection's probably the wrong term. We think about it as building a team, that can work together. And then I think the biggest hurdle that again, over this 3-year period, it was, that patient experience. It's just different. I don't know if we really expected it to be as different 3 years ago when we started this as it is today. I mean, we thought, yep, they come to the site and they're going to be on the site, and how do we keep them on the site? And now that's just not true. They're spending a lot less time, and they're coming in deeper in the funnel. And so that was a part of it that, I don't think we really knew or anticipated as big a hurdle as it really was.
Yeah, I mean, everything keeps evolving and changing so much, as everybody in this room knows, that sometimes it's hard to keep up.
But I will say, I'm glad we actually focused on the data early, because that put us in a position to be able to tackle this new world.
Yeah, I would say you have to build the foundation, right? You have to have, your fundamentals before you can do anything fancy. So if you're trying to do, virtual primary care, and you're trying to do chatbots, and you're trying to, if the data is not behind it, that's all well and good, but it might not be the best experience it can be, or it might not be as easy as it could be if you didn't have the foundation in place. If you don't have the right vendors in place, and you haven't built that foundational MarTech stack, and you haven't built and worked on the data, I know it's boring and it's no fun, and who wants to geek out on the names of the locations and what to name a location when there's 5 locations within a location. We have conversations about that, like hours of conversations around what this, should it be a specialty center? I don't know. So but that kind of work is, again, what makes it consistent, not only on the website, but then it'll also be consistent within MyChart. It'll be consistent when they show up at the location. It'll be consistent when they're searching in the LLMs. The LLMs will give us credit for all that consistency. And so building that foundation is, I think, key. And then now that we're there, we're able to do some of the cool stuff, like the virtual primary cares and the chatbots, and we're going to be able to get fancier and fancier as we go, and more sophisticated. We're building a data dashboard infrastructure currently that pretty much all of our vendors are somehow connected to and automated with. So we're pulling data from all of our various vendors and their dashboards, and pulling that together into an executive dashboard, which I would never be able to do, and has always been a dream of mine to do, but I would never be able to do that if I didn't have that foundation. And now I'm going to be able to serve up that data to the executives and say, here's all the work that's going on with all these vendors that you're paying lots of money to, that you keep trying to cut from me. But this is the work, and then this is and this is the payoff, right? But it takes, it's taken me 3 years to get there. So, yeah.
Yeah.
Oh yeah, so we're still doing more, right? Obviously, I still have dreams. I still have other, lots of stuff to do. And it's funny to talk about synonym matching as a dream, but it's true. And then we're optimizing more towards our researchers really haven't been focused on their profiles because they're in the lab, right? They don't really think about that kind of stuff. But it's important for grants. It's important for patients to see that we have this depth of research. So we're really focusing on our researchers' profiles. We're really focusing on our academic and research content. And we're looking to pull in more data. So we're looking to pull in data from credentialing. We're looking to pull in data from Epic. And our Epic data is messy and very dirty, and will take a lot of time to kind of figure out how that would work. But if those systems can all be talking to each other, and Yext is the source of truth for that physician data, then it will become, again, a better integrated system and be less manual. So it'll take a lot of, I mentioned Kelly earlier, it'll take a little pressure off of Kelly, right? Because some of that data will be automated. And then obviously, We also rolled out a site-wide AI search, which has been great. So this, I don't know if anybody's been in the industry long enough to remember healthcare website search has always been horrific. Like if you've ever gone to a hospital website, the search is always so bad, right? Because you don't have the resources to kind of keep up with it and build it, and it takes a team to do that. But with the AI search, it does it for you, and it's brilliant, and it works great. And so that's something that's really kind of helped us be more sophisticated. So, yeah.
Yeah. Okay. And this sort of gets us into another industry theme that Susie and her team and Tufts exemplify, and that's really owning this definition of a new healthcare website that you kind of just mentioned. So would love to hear, Susie, from your side as we're in this.
Yeah. So we obviously traditionally focus on the presentation, like again what the patient sees. But really, we have to be thinking about what the bots see, and what the data is. What's the schema? What's the content structure? What's the data structure? Do you have FAQs? Are you feeding data to these LLMs? And so you kind of have to split yourself, or I feel like I have to have two brains, right? I have to have the patient brain, thinking about, as I was talking about earlier, what's that patient journey? What does access look like? How do I get through the website as a patient and get to an appointment? But then I have to think about, okay, what's the data structure look like? What is my content structured as? How do I focus on, making sure that my schema is right, making sure that my data is correct so that the bots read my website as they should and serve us up first in those searches. So yeah, it's interesting. It's a juxtaposition, I guess.
Yeah, there's a reason why the AI models will reference or citate MapQuest as a top-ranked source now for information that gets fed up, is because it's easy to read. So what Susie mentioned from just kind of structuring the content and kind of looking at that, it's looking for easy-to-read content. So groups or systems that really structure their data in a clean, easy way, like Tufts has, is going to be fed into AI. And if it's too complicated or it's in the traditional model, there's a good chance that AI is just going to look at it and there's too much noise on it, and they're going to go somewhere else to get that data on you.
Yeah, it's going to be interesting too as we work through the research content, because obviously the academic physicians and researchers, they want paragraphs and paragraphs and paragraphs of everything that they're doing, and rightfully so, they've earned it. But we have to kind of educate them on how the content needs to be structured and how the content needs to be written. And things that we need to do that maybe we didn't have to do in the past. But if they want to show up in these searches, they're gonna have to get on board. But it's an interesting, again, like education for them, and it's our place to kind of guide them and pull them along in that process.
Yeah.
So,
you talked earlier, we mentioned it a couple of times, your late night sessions with your data teams of, cleaning the data, and, really, so thankful that we did that, and your team did that early on, because it really did position us for this new AI world, because what it is, 3,100 providers, 1,600 locations, and it's not just, all right, we've got 3,100 provider, but are they consistent? Are they, do we have the right schema for them? Are the locations tagged to them correctly? Because across all of that provider data, all that location data, as it's being pushed out, and from the consumer, if it's showing up differently on different platforms, it's just going to start to, erode that trust that, you're working to build with this new brand. And so by having that early focus, we don't have to, we're not having to fight harder. And Kyle, something you mentioned to me in another session, AI now has memory, right?
Yes.
So it's not it used to be, all right, hey, we've messed some things up, we're just going to have to fix it and then we can climb back up. That hill's getting a lot harder to climb, right? And so if you don't get your data correct early on, the longer you wait, the steeper the hill is going to be. And I think it's something we were fortunate to have done early, but it's something we haven't stopped doing at any point in time. And then making sure it stays up to date. So we have focused on making sure that we're bringing in new credentialing data when we get a new provider on, getting all that data correct. When people are updating it, understanding the differences in clinical titles and academic titles, and having all that available for all the different audiences of not just patients but researchers and referring physicians has just been superbly critical.
And I would just add to sometimes it's hard to pull resources to do this work that it's not so sexy, right? You're not going to see.
Data's sexy.
Yeah, I mean, I geek out on it, but a lot of people don't, right? So, and or may not understand why you need to do it, or that it's important to do it, because it could be a nightmare. And when there is no source of truth for locations, and you and your team are making it up as you go, and you're pulling from real estate, and you're pulling from Epic, and you're pulling over here, and and your bosses are like, "What are you doing? Why are you focused on this? You should be focused on the pretty pictures, and sending out flyers." And you have to explain to them why this is important and how it's going to again give your hospital or system the foundation that it's going to need for the future. And I can't emphasize that enough. And it's ever evolving too. It's not a one and done. The data is constantly changing and constantly updating. And I actually had a director of operations say to me the other day in a meeting, she was like, "When does the website change?" And I was like, "Huh?" And she's like, "Who changes the website? How often does it change?" And I'm like, okay. I was like, every day, all day, constantly. And she's like, "Really? Is that your team that does that?" And I was like, "Yeah, it's my team that does that." And we're constantly changing it. And she's like, "Yeah, because I went on the other day and it had changed from the day before." And I was like, "In a good way?" And she's like, yeah, you guys updated a location that was old.
Up and to the right.
Yeah. So it's funny because they don't even understand, that you're doing this work constantly, but and why you need the resources to do it and why it's so important to do it. So.
Yeah. So then we go into just kind of, finalizing and putting a bow on this, right? So we've talked a lot about the Find a Doc, the data strategy, and just the overall structure and getting together as a team. Susie's team, on top of all this, also started managing their listing profiles on third-party sites and managing the rep management stuff. I know that's been around for over a decade, but some systems aren't doing it still now.
We didn't have our act together until
coming together and doing it. So they really started moving from step to step after establishing the data. And I think where they're at right now, and again where we're continuing going to go, is Tufts was one of the first clients of ours that really want to understand Tufts at a hyper local level and using the AI and brand visibility aspect of that, right? So it wasn't just understanding what Google's saying and the traditional stuff. They were the first ones to really lean in on the hyper-local stuff. And I know that at a brand level, that's generally been around for how does your brand stand out when someone asks for it on the AI models. But what's different about this is patients are generally looking for care at a local level, right? Someone in Indiana isn't looking for someone in Boston to say, who's the best primary care near me? They still have a local feel to it. And Susie's team, really leaned into this. And generally what we've seen at health systems to get to this point on the second box, it's not necessarily an AI problem or a tech problem that they need to invest in. It's more of an alignment problem. And what Susie and them did before that point, they've got continuity so they can really carry this momentum into it, right? And now we go into the last part of what we're going to do next. I know Marshall had mentioned a point about AI having memory, and as we go, these AI models are training themselves on the answers that they're giving to consumers. So it's not a thing where, as he said, you can go fix it in 6 months. There is a bit of urgency into this aspect of it, and in fact, one thing we saw too, and we'll track millions of citations, but if a consumer asks, should I go visit this doctor? And there's maybe some negative sentiment, and it could be that the hours are incorrect on different directories. It could be there's actually negative reviews. Almost 70% of the time that AI is recommending a named brand competitor. They're not even just saying you shouldn't go there. They're saying, hey, you shouldn't go there and you should go to this. So they're almost rewarding that. And as we talk about memory and it compounds, if that user then says, okay, sounds great, that AI model is assuming that that answer was relevant and good for them. So the next time they look for care for their kid, their mom, themselves, and they look for something else, the default answer is going to be that system that got fed it to the first time. So as we think about all the things that are, data and how can we show up in this and how can we show up in this, and I think the best way that people can really address this is just make sure you're taking this seriously and you build that continuity early like Susie and them did, and you really jump on this because things are going to change pretty rapidly, and I think today is probably the slowest that things are going to move, and for the rest of the time, and it's only going to get faster. So this time next year, I'm sure there will be 18 other different topics that we'll talk about, but AI will definitely be one of them.
How many of you are managing your listings? Okay. Good. And also managing reputation management on top of that, the reviews and Google solicitations and all that jazz, yeah. Because that's also critical, right, to this whole thing, is that that will just, again, assure the LLMs that the reviews, if your reviews are good, they're going to use that to verify your search, right, and verify that you're a qualified, physician or hospital or whatever it might be. So it's important that you're managing those listings, making sure that they're as accurate as they can be, and then also pushing out those reviews and getting those review solicitations so you get more and more reviews, so that becomes again, you become that credible source. So
good.
Yeah.
Okay, we got 5 minutes left. I'm glad we got some time for questions, so I'd love to hear if there's any questions from anybody. Yes.
Did you also work on your Google business profiles
Yeah.
at the same time as your website presence?
So we did the website first, and then we worked on the listings. And no really rhyme or reason other than resources. We just wanted to, prioritize the website data first. But we used that to then lead to the listings. So it was easier for us to clean up those listings. And you should see these spreadsheets because we were going through a rebrand and we're still going through a rebrand. So we have old name, current name, new name. And we have to kind of manage that with the listings, right? But whatever we do with the listings is also what we push back to the Epic team and ask them to update my chart as well, which is also a big project, because then there's downstream issues with that as well, because bill pay and all of that stuff. So if you update a name, as you guys know, there's a lot of ramifications for that. But we did it in steps, but yeah, we did the listing second.
Do you find that there are certain on the Google business profiles that you need to add there that is not coming from your website, such as additional photos?
Yes.
Any other description?
Yeah, so the tool that Kyle was talking about actually tells us what we need to do better, right? Or to show up more and to have more brand visibility. So it actually says to us, you haven't added photos to this location in a while, or there hasn't been a lot of reviews for this location in a while. You need to make optimizations and changes. And I was at a offsite meeting in Lowell the other week, and I'm literally outside taking photos of this location because it needed to be optimized, right? And Google wants real people to be doing that. They want your patients to be doing that. They want engagement. But sometimes you have to force it a little bit. But yeah, it tells us what we need to update, so it's not always website. Yeah.
Okay. Good question.
Yeah.
For the appointments that you're exposing on the webpage, did you run into any operational issues when pushing that live? Because I am curious how you overcame going through a decision
Tree, yeah.
to expose those appointments.
Okay, so lessons from Epic implementations. Has anybody gone through an Epic implementation? Yeah, okay. So, love Epic, nothing, whatever. But we were, all of our departments had different templates. And so they had, at implementation, they were all allowed to kind of do their own thing and make their own choices. And so now they're going back and fixing all of that. And they're standardizing the templates so that they're easier to navigate, and they're not asking 800 million questions about disease state before you even book the appointment. So we we struggled with that. It's been a growing pain of ours. So if you're in that process early, I would bring that up early. I would talk about, how does this look for the patient? Think about the patient. Because the physicians, if they're left up to their own devices, are going to think about, what do I need to make my life as a physician easier? Like, how can I understand what this patient is coming in with before I even see them? Whereas the patient wants to just go see the doctor, right? So there's an issue with some of that, and you have to kind of find a happy medium. But that's why I started inserting myself into those conversations, because it was making the website experience horrible. And we still have issues with it. Like, we're still working through a lot of this stuff. So it's a work in progress. But the MyChart team is more than willing to fix things, help us with things. They are, totally on board with, making it as easy as possible. And they were just kind of not doing what they were told, but kind of doing what they were told at first, just to get it up and running. And now we're going back and fixing it.
And I will just add on, I think, with Tufts and with other health systems we've worked with, it's one thing when you find that right provider and, it just says, all right, call for an appointment. That's not great. But when you can, click here to book an appointment, and then you go down, 3 questions, and then it says, call to book an appointment.
Oh, yeah, it's a nightmare.
The drop-off is even worse. So really thinking through that, and and we know this from years of working in in the consumer industry and retail products. The longer the shopping cart process was, the more the drop-off was. The same principles apply here.
Right.
So trying to find that happy medium is definitely the right approach.
And I would also say consistency with locations too. Like, not everybody was, because we were so different, not all the entities or locations were on the same page and willing to be part of the same process. So if like, some of our patient journeys are very clunky, because it's like, here's online scheduling for Boston, Lowell, and Melrose, but if you want to go to Brookline, Quincy, or name a city, you got to go through a request an appointment form, because those guys aren't on board with the online scheduling. So and again, that's an operational issue that they need to figure out, but it doesn't make me look very good, right? So yeah.
Yeah.
Like an access, like team, if you will. Yeah, so that's our MyChart team. Yeah, so yeah, I guess we just call it something different. But yeah, they just build those decision trees. Yeah. Oh, I don't have a strategy group that maps it out. That's amazing.
Well, it's kind of a catch-22, right? Because it puts us in a position where we're negotiating with them, and they're kind of defending the positions.
Oh yeah. Are they mostly clinical? Are they doing it from like a clinical perspective?
They report out to the operations, so there's pressure for them to align.
Yeah, that's. Can you get on the committee?
I am on the.
Oh, you are. Okay.
We have situations where we're like, well, our research shows us that patients don't want to answer more than 7 questions. Well,
Yeah.
our physicians want to ask 15 questions.
Right. Yeah, it's a dance, right? It's a negotiation, because as I was saying before, the clinicians want to do it the way that they want to do it from a clinical standpoint, which I totally get. But it's like, sometimes when I talk to them, I'm like, let's think about that after the patient like maybe books the appointment, right? So just like you have to do insurance verification, let's do condition and pre-registration verification, and let's leave some of those clinical questions for that, right? So that your chart is complete and it's full and you have all the information that you need, but it's not a barrier to entry for the patient. Because to your point, like, who wants to answer? I don't want to answer all these questions. I just want a primary care appointment. Like, you don't need to know my whole life history before I get there. You'll get it when I fill out the pre-registration form. You know what I mean? So, yeah, that's tough. That's a tough one.
We're at time, but any other questions?
Okay.
I'm also around today if anybody just wants to grab me too and chit chat or commiserate. I'm also good for that too.
Yeah. I mean, thank you all for coming. It's
Yes.
great to have this many
Thank
people.
you guys.